Hello, my friends. I'm Dr. Jocelyn, a urologist and men's health specialist with 5 years of clinical experience. And today, I'm going to give you advice that most men never hear in their lifetime. This is the kind of conversation that might make you blush a little, but I promise you, it will change the way you think about intimacy, confidence, and even your health as a man. Here's the truth that nobody tells older men. Intimacy does not retire. Passion doesn't have an expiration date. Yet I see too many men giving up, thinking they're too old for deeper connection, or worse, that their body is betraying them. But here's the myth we need to bust today. Problems in the bedroom are not always just age. Often they're linked to small, manageable habits, things you can change starting right now. And today we're going to explore one of those exact topics men ask me about all the time. Intimacy practices that feel taboo to discuss, but actually open the door to more trust, more pleasure, and better performance. I've spent the last 5 years as a urologist helping men just like you, men in their 50s, 60s, 70s, and beyond, reclaim confidence in their health and their intimate life. I can tell you this, the science is clear. When men understand how the body really works, the biology, the emotions, and the day-to-day reality, they make better choices. They reconnect with their partners, and they rediscover a kind of freedom many thought they had lost forever. So today, I want to break it all down into clear, practical advice you can use. Let's walk through 5 key truths and mistakes men often make about intimacy, fluids, and connection, each one building on the last. Habit mistake number 5, thinking vaginal fluids are dirty. Let's start here because this is the root of so much embarrassment. I need you to understand something fundamental. Vaginal fluids are not random moisture. They're a masterpiece of the human body, a biological system refined over millions of years of evolution. These fluids are produced by 3 main sources working in perfect harmony. First, the Bartholin's glands, tucked near the vaginal opening, secrete a silky fluid specifically designed to reduce friction and make intimacy comfortable. Second, the Skene's glands, sometimes called the female prostate, add more lubrication during arousal, responding to excitement and touch. Third, the cervix itself provides mucus that protects and balances the entire vaginal environment, maintaining the perfect pH to ward off infections. What are these fluids made of? They're mostly water, yes, but they also contain amino acids, the building blocks of proteins, enzymes that break down harmful bacteria, minerals like calcium and zinc, and lactic acid, which keeps the vaginal environment slightly acidic, protecting against infection. This isn't waste or dirt. This is the body's natural pharmacy designed to protect delicate tissue, reduce infection risk, and make intimacy safe and pleasurable for both partners. But here's what happens emotionally when a man rejects or judges these fluids. It creates shame in a woman, deep, quiet shame that she may never voice, but will absolutely feel. She begins to wonder if something is wrong with her body, if she's somehow defective or unclean. That shame doesn't just hurt her, it damages the relationship. Practically speaking, it makes intimacy feel unsafe. She may pull away, become self-conscious, or avoid closeness altogether. Not because she doesn't desire connection, but because she's protecting herself from perceived rejection. So here's the shift I want you to make today. Don't think of these fluids as gross or inconvenient. Think of them as the body's natural signal that connection is possible and safe. They're a green light, a sign that her body trusts you, that it's preparing for intimacy, that arousal is present. When you accept them, you're accepting her. And that acceptance is the foundation of everything beautiful that follows. Habit mistake number 4, ignoring taste and smell. This is the number 1 private question men ask me behind closed doors. Doctor, what about the taste or smell? I get it. It's a vulnerable question to ask, but let me give you the biological truth, the kind of honest answer you deserve. Fluids vary. They vary from woman to woman, from day to day, even from morning to evening. And that variation is completely normal and healthy. What influences taste and smell? Diet plays a massive role. Pineapple, citrus fruits, and good hydration often lead to a fresher, lighter taste. Garlic, onions, alcohol, coffee, or heavily spiced foods can create a stronger edge. Hormones shift the profile throughout the month. Around ovulation, fluids tend to be more neutral, clear, and mild. Around menstruation, there may be a faint metallic note due to trace amounts of blood. After menopause, fluids may be less abundant or slightly more acidic as estrogen levels decline. Stress, medications, even where a woman is in her cycle, all of this affects the chemistry. Here's what matters emotionally. Variation is normal. No two men smell the same after a workout. No two women taste the same either. And just like you wouldn't want your partner to recoil from your natural scent, she doesn't want to feel judged for hers. Acceptance doesn't mean pretending you don't notice. It means understanding that what you notice is natural, human, and nothing to be ashamed of. Now, practically, if there's a sudden unpleasant change accompanied by discomfort, itching, unusual discharge, or a fishy odor, it's usually a common treatable imbalance. Bacterial vaginosis, a yeast infection, or trichomoniasis. These are not moral failures. They're medical conditions, and they're easily treated with a doctor's visit. That's not a deal breaker. That's an opportunity for care and partnership. The mistake is turning normal variation into criticism. Gentlemen, acceptance is more arousing than judgment. When she feels accepted, she relaxes. And when she relaxes, intimacy deepens. Habit mistake number 3, overlooking safety. Now the big question, is it safe to swallow vaginal fluids? The short answer for healthy couples is yes. These fluids are mostly water, enzymes, and protective compounds. In fact, they're biologically less risky than things we do without thinking, like kissing or sharing drinks. But here's the caution, and I need you to hear this clearly. Fluids can carry sexually transmitted infections, just like semen or blood. Chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, and HIV can all be transmitted through vaginal fluids. The risk is higher if one partner has an active infection, and it's even higher if the receiving partner has mouth sores, bleeding gums, or ulcers that create an entry point for pathogens. Biologically, the risk exists. That's not fear-mongering, that's fact. But emotionally, honesty is the safeguard. When both partners know their status and share that information openly, the fear dissolves. You move from worry to confidence. Practically, the fix is simple. Know your status. Get tested together. Make it a routine part of your healthcare, not a one-time event prompted by suspicion. Twice a year is a healthy standard for sexually active adults. Use barriers when needed, especially in new relationships or if either partner's status is unknown. The mistake is assuming no symptoms means no risk. Many infections are silent. True intimacy comes with trust and transparency. Safety does not kill romance. Safety builds trust, and trust makes passion last for decades. Habit mistake number 2, staying silent out of embarrassment. I've seen couples lose connection not because of illness or age, but because of silence. A change in smell, a question about safety, a curiosity about trying oral intimacy. Left unspoken, these concerns grow into shame, resentment, and distance. One partner wonders, the other worries, and neither one knows how to start the conversation without causing hurt. Biologically, the body is always changing. After menopause, after illness, after surgery, even after a simple change in diet or medication, fluids change too. That's not failure, that's life. But emotionally, when couples hide their concerns, the other partner feels rejection without explanation. She notices you pulling away but doesn't know why. He seems distant but won't say what's wrong. The gap widens. Practically, small issues go untreated. A minor infection becomes chronic discomfort. A question about safety becomes unspoken anxiety. Intimacy becomes awkward and partners pull away. Not because they've stopped loving each other, but because they've stopped talking. The mistake is silence. The solution is communication with kindness, curiosity, and respect. You don't need to have all the answers. You just need to start the conversation. Try this. I've noticed something different and I want to make sure you're feeling okay. Can we talk about it? Or, I have a question I'm a little embarrassed to ask, but I trust you. Can we figure this out together? That kind of openness doesn't weaken intimacy. It strengthens it. Habit mistake number 1, forgetting the emotional power of acceptance. This, my friends, is the most powerful lesson I can share with you today. When a man embraces his partner fully, including her fluids, her scent, her natural self, he communicates something profound. I accept you completely. I trust you. I love every part of you. Not just the parts that are convenient or socially polished, but all of you. Biologically, that acceptance helps a woman relax. And when she relaxes, her body responds. Arousal deepens. Natural lubrication increases. The nervous system shifts from fight or flight to rest and connect. Blood flow to the genitals increases. Sensitivity heightens. the entire experience becomes richer, more pleasurable, more connected. Emotionally, acceptance heals years of quiet shame women have carried about their bodies. Shame taught by inadequate sex education, by media that portrays female bodies as problems to be solved, by partners who recoiled or made offhand comments that cut deeper than they realized. When you accept her, you undo that damage. You tell her without words that she is not too much or too little. She is exactly right. Practically, this acceptance makes intimacy joyful, playful, and fear-free. There's no performance anxiety, no hiding, no second guessing. Just two people choosing each other fully again and again. The biggest mistake men make is thinking intimacy is just mechanics. Positions, duration, technique. Those things matter, but they're secondary. In reality, the strongest performance enhancer you'll ever discover is your partner feeling fully accepted. When she feels safe, desired, and valued, everything else falls into place. So what do you do with all this information? How do you take these truths and turn them into real change in your life? Here's a simple 3-step action plan you can start today. First, have the health conversation. Gently suggest testing together. Frame it as partnership, not mistrust. You're not accusing anyone of anything. You're simply saying, let's take care of our health together so we can enjoy intimacy without worry. Twice a year is a healthy standard. Make it routine, make it normal, make it an act of love. Second, pay attention but don't judge. If something smells different, suggest a refreshing shower together. Not as criticism, but as connection. Encourage hydration. Support her in checking with her doctor if she's noticed changes too. Approach it as a team, not as a problem she needs to fix alone. Small gestures of care matter more than you realize. Leaving a glass of water on her nightstand, suggesting a warm bath together. These things say, I'm here with you, we're in this together. Third, practice acceptance. This is the daily work. Remind yourself that her individuality is not a flaw. Her fluids are not dirty. They're a sign of health, readiness, and trust. When you catch yourself having a judgmental thought, pause. Ask yourself, is this thought helping or hurting our connection? Then choose acceptance consciously, deliberately, lovingly. I know some of you might still feel shy about this topic. That's okay. This is vulnerable territory. But let me reassure you, you are not alone. Every man in my clinic asks these same questions. Every couple worries about the same things. And when they finally talk about it with honesty and care, their intimacy not only survives, it thrives. I've seen it happen hundreds of times. The relief on their faces when they realize they're normal. The renewed closeness when they stop hiding and start connecting. Remember this, safety does not kill romance. Safety builds trust, and trust makes passion last for decades. You don't have to choose between spontaneity and health. You can have both. You don't have to pretend everything is perfect. You can be honest and still be loving. You don't have to have all the answers. You just have to be willing to learn together. So gentlemen, here's the final takeaway. Passion doesn't retire. Your 60s, 70s, even 80s can be your most connected, most confident years if you let go of shame, embrace acceptance, and care for your health together. Don't waste money on gimmicks or unsafe pills that promise miracles. The real miracle is right in front of you. Care for your body, talk openly with your partner, embrace intimacy fully without reservation or fear. I'm Dr. Jocelyn, and remember, small changes can bring freedom, comfort, and confidence back into your life. Passion does not expire, and neither should your willingness to connect deeply, honestly, and beautifully with the person you love.